This episode is brought to you by State Farm. Knowing you could be saving money for the things you really want is a great feeling. Talk to a State Farm agent today to learn how you can choose to bundle and save with the Personal Price Plan. Like a good neighbor, State Farm is there. Prices are based on rating plans that vary by state. Coverage options are selected by the customer. Availability, amount of discounts and savings, and eligibility vary by state.
Well, hi there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing Podcast where I share a quick tip you can start using to affect your practice or your habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. So today we're talking about how to kind of shift your mindset, shift your day, shift everything when you are taking on a difficult patient assignment. And I'm not talking about a heavy assignment where you've got 5 patients and they're all very sick. I'm talking about that one patient who's maybe got a reputation for being difficult to manage as far as maybe they're angry, frustrated, refusing care, all those kinds of things. So air quotes around the word difficult, because that could mean a lot of different things to different people. So something that I learned really early on as a nurse in the ICU was to really hold off on making perceptive formulations about my patients based on either what I read in the medical record as I'm preparing to get report or from what I hear in report. Because time and time again, I would get report on a patient who the nurse said was really difficult, really demanding, or uncooperative, or even violent, only to discover that that wasn't actually all that true. At least for me, it wasn't all that true. Maybe it's because, I didn't walk into the room with a preconceived notion about the patient, and I performed my own assessment of the situation. And what I found after doing this for quite a few years was that in many cases, the patient simply wanted to be heard, wanted to be understood, wanted to be an active participant in their plan and know what's going on, right? So does this mean that you should not be mindful when people tell you that your patient might be demanding or violent or uncooperative? Of course not. You're still going to have that in your head, especially with reports of violence. You definitely want to carry that awareness in with you as you are approaching the patient. But it doesn't mean that you should immediately be afraid of your patient either. Be wary, be careful, keep your distance, but you can still do your job while doing all of those things. And in some cases, de-escalate a patient who's having a really difficult time. So I remember once I cared for a patient whose chart had been flagged as high risk for violence. And this is a safety measure that my hospital uses, probably lots of hospitals use, to make sure that anybody walking into the room is aware that they need to be extra alert, extra mindful of the situation when they enter that patient's personal space. So 9 times out of 10, at least in my experience, is that the violent patient would behave in an appropriate way. And that is probably also because somebody before me set some really good boundaries, which I'm always very thankful for. But I also wanted to make sure that as I was providing care for this patient, I didn't hold back on providing excellent care just because they were potentially going to be difficult or aggressive. I wanted to make sure they still got the very best care that I could possibly provide. So one of the things that I always like to do, especially with patients who are aggressive, assertive, violent, uncooperative, demanding, whatever it is communicate. Communication is humongous, right? It's a huge, huge thing. And sometimes we don't do it well or we don't do enough of it. And a great thing to do is communicate with the patient before performing interventions, before just walking up to them and taking a blood sugar or putting a blood pressure cuff on them, right? Telling them what you're going to do, how you're going to do it, all of those things. Address their concerns, ask questions about their experience and what they're going through. And again, just displaying that caring and competent demeanor so that they feel like they're in good hands when they're under my care, when they're under my watch. But again, I'm also not completely naive. I don't go in there thinking it's all going to be sunshine and roses. I do avoid getting within arm's reach until I know that I can kind of gauge and trust how they're going to react to that. I also keep an eye out for items in the room that could potentially be used against me, such as call lights. I had a patient once who was swinging that thing around like one of those medieval weapons. You know, that ball with the spikes on the end and they swing it around? He was swinging it around like that and telling me he was going to kill me. Spoiler alert, he did not kill me, but we did have to kind of regroup, reassess, and approach this patient in a completely different way for the rest of the day. So I'm keeping an eye out for things like that, utensils, anything that could be a potential weapon. And again, I'm still going to provide patients with the same level of care. Unless, of course, it really is dangerous and I can't even get in there to take vital signs, then I'm going to be communicating that to the MD. There is going to be something else that might need to be done for a patient who is just acting out, so violent, so aggressive that you can't do anything with them. You want to make sure that you communicate that right away. So when you get report or you're reading the chart, you know you're getting a patient from the ER, whatever it is, and you hear about the patient being demanding and cooperative, violent, even aggressive, rude, just try to keep your own feelings out of it. Remind yourself that you're going to stay very aware. You're going to make extra effort to be extra professional in your communication. And in many cases, you will find that you and the patient can arrive at a therapeutic working relationship. So I hope this shorty episode helped you. And if you want to dive deeper into any of nursing related topics, then you want to tune back in on Thursdays. I'll see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing related content, go to straightanursingstudent.com.
Hello, we want to recommend our podcast, don't we, Rowan?
We do, Penny. It's called The World, the Universe and Us from New Scientist, and it's your essential weekly dose of science and wonder. Hosted by me, Dr. Rowan Hooper.
And me, Dr. Penny Sarche. Each week we talk to the scientists in the news and draw on new scientists on parallel depth of reporting to put the stories that matter into context. It's brain food.
It's brain food. It feeds your brain and your curiosity, and it's a dose of optimism.
The World, the Universe and Us. Get it wherever you get your podcasts.